Can you fix scoliosis without surgery? People with scoliosis are always looking for a way that they can kind of fix, cure, totally correct their scoliosis. And so the question is, can I correct or fix or totally cure my scoliosis? And the simple answer is, as far as we know, regarding any treatment option, that it cannot be completely corrected, fixed, or cured. People hope, and they use this term a lot, like, okay, I'm gonna get my scoliosis corrected, or get my scoliosis fixed, or get it cured. And the truth is, that's not really what's happening, is that we really are just managing scoliosis, but we're not curing or fixing it. We've seen great results in reducing scoliosis using conservative methods, even methods that don't require invasive surgery. But the idea is that the more proactive you are at managing your scoliosis before it becomes extremely severe, the greater chance that you have at having successful management without surgery. And one thing is that the traditional approach tends to lead patients to surgery. And when I go over this, you're going to understand why. Is because the traditional approach is not a very proactive approach. In fact, it's exactly opposite of that. It's a reactive approach. Traditional approaches need to see curve progression before they treat, meaning if they find a small curve, say a curve that's less than 25 degrees, the recommendation is always just watch it and see what happens. It doesn't matter if you're a child or an adult. If you're experiencing any kind of symptoms or pain, it's normally just pain treatment. And they have to see your curve worsen before they're willing to do anything else. So that tells you that at this moment, you're losing the opportunity at dealing with a small curve and keeping it small. They have to let a small curve become bigger before it warrants any kind of treatment, which really makes no sense, because when it comes to health and well-being, we know the majority of issues that you deal with, if it's deal with it when it's smaller, it's way better than dealing with it when it's bigger. And when it's bigger, it normally means more invasive treatment. And that's exactly true when it comes to scoliosis and the treatment options associated with it. The second approach is if it's greater than 25 degrees but less than 40 and you're still growing, then they would recommend a brace to try to slow it down during the growth phase. But once you're done growing, this category also receives no treatment. It's called moderate scoliosis between 20 and 40 degrees. No treatment's recommended. They have to see it worsen before they do anything else. And then once you break 40, now the scoliosis has become severe enough, it warrants the risk of doing spinal fusion surgery. Remember, if surgery didn't have no risk associated or no complications associated, they would do surgery at 20 degrees. But the reason why they wait till 40 or 45 degrees is because now the risk of the scoliosis is starting to outweigh the risk of the surgery, and they're willing to risk this type of invasive treatment to actually try to go in there and try to fuse the spine with rods and screws. There are definitely risks associated with spinal fusion when it comes to surgery, because they're not just fusing one bone or two bones. Remember, they're fusing anywhere from 9, 12, 13, 14 different vertebrae. So there could be things like infection. There could be poor healing. Your body could have a rejection to the rods where they actually have to remove them. There could be bleeding. There could be blood clots. There could be limited flexibility as a result of it, which we almost know there will be because there is something called fusion. They're fusing the spine. Sometimes there's a very long recovery time, and there's also the possibility of future surgeries, meaning that the surgery and the curve still progress post-surgery, and yet you need a further surgery, or there could be failed hardware that could lead to further surgery, or there could be just continued progression where they have to extend your fusion beyond your current fusion. So you can see that the risk of letting your curve worsen to where it becomes bad enough to where now they can actually do some treatment, which is surgery, comes with a whole host of risks. So what else can you do to conservatively deal with your scoliosis, to manage it properly so you don't have to deal with this invasive surgery option on managing your scoliosis? Well, the first thing is the more proactive you are, the earlier you deal with the scoliosis, the better results that you're going to get. Conservative treatments need to focus not only the likelihood of progression, but also structurally reducing the curve, meaning a conservative approach that just deals with the pain is not going to stop the progression from occurring in an adolescent case or even adult case. Typically, successful conservative approaches are multimodal, meaning they're using therapy, exercises, rehabilitation, chiropractic, corrective bracing, neuromuscular education, vibration, lots of different therapies and rehabs to get the benefits of each one added together to get the very best reduction in the scoliosis. Again, we're not curing, we're not fixing, we're reducing and we're managing the scoliosis so it doesn't snowball and progress during adolescence or snowball and progress in the adult stage, what happens because of gravity over time. So when we look at scoliosis management, we understand that we can't fix it, we can't cure it, no matter what options that you choose. But the more you manage your scoliosis, the less likely it is to cause future issues as you tend to go out throughout your life. So you have to make a choice. You have to choose. Do you want to manage the scoliosis with rods and screws and multiple surgeries that could have a high risk associated with it? And the truth is, we don't know how patients respond 20, 30, 40 years post-surgery compared to patients who never have had surgery. Or do you want to manage it with therapy, exercise, rehab, chiropractic care, corrective bracing, and things that help manage the scoliosis and reduce it and keep the scoliosis down while still retaining the function of your spine? Because once you fuse it, the spine is no longer functional. I mean, it's no longer moving. It may be straighter, but it's not functional. How can we reduce it, manage it, and maintain its function? Traditional approach pretty much lead you to surgery, meaning that in order to be treated, your curve has to worsen before so it can become severe enough for them to justify the need for surgery. And we know surgery has lots of complications. However, if you choose the opposite approach, which is a conservative approach, which is more proactive, we start treating earlier to help keep the curve down so you don't deal with the effects of a progressing scoliosis or the risks associated with severe surgery. If you want to know more about these options in terms of managing scoliosis with more conservative options, like we mentioned, definitely reach out, contact the link below, and see if you can if you qualify to be one of the patients that can actually get some reduction in your scoliosis so you don't have to deal with further progression. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.